begin the abdominal exam, first inspect for any gross abnormalities or skin changes. Then move on to auscultation. You want to auscultate before any palpation. Auscultate the abdomen in 4 quadrants. Be sure to be systematic. You're listening for any abdominal sounds or any bruits. Here you can also listen over the renal arteries and the abdominal artery for bruits. Next, percuss the abdomen. Percuss in all 4 quadrants, assessing for the degree of tympany. Now we are going to percuss the liver size. You want to start in the midclavicular line, above the liver. Percuss down until the percussion becomes notably more dull. This is the superior aspect of the liver. Mark this so that you can measure it later on. You can place your ruler where you first notice the change in sound. Percuss down until dullness becomes more tympanic. This is the inferior edge of the liver. Mark this as well and measure the distance between these two. This is your width of the liver. Next, attempt to percuss the spleen. You want to do it in the anterior axillary line in the lowest intercostal space. This area should be tympanic. Now move on to palpation. Start light. Palpate in all 4 quadrants, looking at the patient's face to assess for any grimacing. Now palpate more deeply and more firmly. Again, palpate in all 4 quadrants and look at the patient's face to assess for any pain while doing so. Place your left hand posterior to the patient below their ribs. Lift up. With your right hand, push in and up as the patient takes a deep breath in. To try to palpate the spleen, use your left hand behind the patient to lift up. With your right hand, push in and up as the patient takes a deep breath in. Unless the patient has splenomegaly, nothing should be palpated. To assess the size of the abdominal aorta, have the patient lie supine. Have a ruler handy so you can measure. Palpate deeply in the midline, about 2 to 3 centimeters above the umbilicus. Move out laterally until you no longer feel pulsations. This is the width of the aorta. Measure it with your ruler.